For more on this, Laura Lopez Gonzalez joins us now live from Johannesburg. Laura, South Africa is one of the hardest hit countries by COVID in the continent. Are health officials eager to get access to this pill and use it across the nation?
Right. No, I think you're right. We are very hard hit here in South Africa. I think it's important to note that South Africa appears to be hardest hit because we have one of the best sort of levels of access to COVID-19 treatments, or testing rather, in Africa, and that it's pretty hard to make out what exactly is happening in many other African countries. That being said, South Africa has looked at in the past procuring other kinds of COVID-19 treatments. The initial WHO approved treatments were called monoclonal antibodies. They have to be administered through IVs in hospital settings. The World Health Organization here in Africa said that in Africa costs about $2,000 per patient. South Africa couldn't afford then to introduce that kind of treatment. We already have some interest from local producers here in South Africa to produce the Merck pill, which was the first pandemic license granted by the Medicines Patent Pool. So I think that if countries step up and are able to produce this pill, I think countries like South Africa and many others in the region will certainly jump at the chance to get a hold of this kind of treatment.
Right. What's the current vaccination rate in the country, and how is the government currently dealing with the COVID-19 pandemic situation?
Right. So we have vaccinated about 24 million people here in South Africa, or rather, the government has. And initially, the government set a very ambitious target to vaccinate 70% of adults by the end of the year. It's looking more like the government will hit about 50% of adults, which leaves quite a big gap. It's still unclear what is the issue there for people who are not coming forward, whether it's hesitancy or whether it's simply logistics in a country where spending the day in a queue can really cost you money to put food on the table. So there's been big ramp ups of vaccine campaigns, vaccinating through weekends, putting vaccines on trains to rural communities. But it looks like the country is bracing for a fourth surge or wave. As we head into December and in the beginning of next year, which really is a time in South Africa where people return home to the rural areas, large family gatherings, and still we have that vaccine gap.
All right, Laura Lopez Gonzalez, thank you so much for joining us on the NewsHour.